We've got a doctor here to break it all down. Dr. William Schaffner, great to see you again. You're a professor of infectious diseases at Vanderbilt University, so the perfect guy to talk about this. Thanks for being here.
Good to be with you, Anna.
And I'm looking at these numbers, and Hantavirus infections are rare here in this country, with only 20 to 50 cases every year. What factors in Mammoth Lakes would create such a cluster of cases right now?
Well, these hantavirus infections come from mice, deer mice, and the population of deer mice varies from year to year. If there's a surge in the population, these deer mice, many of them, go indoors, try to get inside your house, in your sheds, garages, and the like. And obviously, they leave their droppings behind. And as the story said, their urine, which contains the virus, can contaminate the environment, and the virus can persist over time. Now, you go in there and you try to clean up your shed. And if there's not good air in there, and if you're not wearing a mask and gloves also, you may aerosolize the area as you're cleaning up. In fact, one of the cases was thought to be vacuuming an area where mice had been. That would create an aerosol. And if that's the case, that dried aerosol can be breathed in, get down into your lungs, and initiate the infection. You could also get it on your hands, touch your mouth, and introduce the infection that way.
Yeah, I mean, even just vacuuming, though, you would just, I mean, I vacuum my house all the time. And what if you just thought it was dirt that you were picking up or something? So I guess we got to wear our masks while we're cleaning our house. Wild. Now, these recent victims, they didn't engage in any high-risk activities that we know of. So how do you think that the virus may have been transmitted in these cases?
Well, these people are often very, very sick by the time they come to medical attention, and you can't really question them directly about the activities they've been engaged in. You have to ask their friends and parents and other members of their families, and they may not know exactly what's been going on. So we have a gap in information there.
All right, what about human antibodies or a vaccine? Anything like that? I mean, if it's something that seems to be on the rise, at least in this small town with the deer mice population getting bigger, we hope it's not. We don't want to be alarmist, but we hope that it's not going to spread across the country. So what could we have a vaccine against this?
Well, this is geographically located, and as the story said, there are relatively few cases out there, so there hasn't been a whole lot of rationale to develop a vaccine, which could be hugely expensive. So we caution people to be careful when they're cleaning up areas where mice may have been. Wear those gloves, wear the masks, disinfect the area first, spray it with a disinfectant. That also makes it less likely that there'll be an aerosol because you've dampened it down.
Yeah, smart. All right, Dr. William Schaffner, great to see you. Thanks for joining us.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.